Good afternoon. My name is Sue Williams. I am privileged to be the Department Head of Human Development and Family Science at Oklahoma State University. So I'm part of your family, or many of your family. I'm very pleased to introduce the second in a series of seminars that is being sponsored by the Center for Family Resilience. And we are very fortunate to have our speaker today, who is Dr. Joseph Grzywacz. Dr. Grzywacz came to us July 1 of 2012 from Wake Forest. Dr. Grzywacz has all of his degrees, and he said depending on definition, in the human sciences. He has done some wonderful participatory research, community-based research, focused on the well-being of individuals and families, particularly disadvantaged families, looked at workforce issues and many issues related to the contextual well-being of individuals and families. He is an expert in building partnerships to facilitate comprehensive research, and we are very pleased to have him. And his title is behind me, but he is our senior scholar in family resilience, and he's also the George Kaiser Family Foundation Endowed Chair in Family Resilience, and we're glad to have you, Joe.
Thank you.
See, I was nicer than
That's right. You were way nicer than I thought you were going to be. All right, so I'm gonna cruise this right along because I really wanted to start on time, but obviously things didn't happen. And I maintain that to a certain degree, our seminar series is a little bit cursed because so far 2 out of 2, we've had computer snafus. We had to substitute in at the last minute a laptop computer. Fortunately, Amanda had one, so we were able to do that. And so we also have to do some extra things with, I'm carrying 2 mics, and if we get some feedback, just let me know. But the main reason that we're all here, quite frankly, is to try to build some linkages. And I see we're failing already because we have a whole bunch of human science people here and some health sciences here, and 2 lonely health sciences folks. And so I would like to encourage at least 5 human science folks to pick up your plates. Perhaps those who missed the instruction that says don't go beyond the 4th row, to pick up your plates and come and join the health sciences faculty down here in front. Because that's what this seminar series is all about, is to try to build linkages between the health sciences and human sciences faculty so that we can become more competitive for different kinds of science, team science with the National Institutes of Health. Towards that, the research that I'm going to be talking about today, of course, I've only been here for 6 months, and so I can only go so far, and I haven't figured out how to work this widget thing, so I'll do it the old-fashioned way. But all this research started when I was on faculty at Wake Forest School of Medicine. I'm still connected with the project. As you'll see later on, we're about halfway through this 5-year project, but I want to make sure that it's very clear that this research is being done in North Carolina. It's being largely fielded at this stage of the game by faculty at Wake Forest. And so frankly, at this stage of the game, I'm just the recipient of data and those kinds of things to be able to answer questions. But the main objectives that I have are the same that you saw on the flyer, and frankly, this is a little bit of teaching to the test. As I'm putting together the slides, I need to make sure that when you fill out your evaluation forms, that I'm feeding you with the information that I promised as part of the advertisement. So I'm not going to go over those things, but I'm going to get straight into some of the content that we have. Now, a lot of people, when they think of farm workers, they think of grandpa who owned a farm, or they think of their neighbor down the street who's running some sort of a agribusiness, or they think of Uncle Milt who may be milking a few cows or something along that line. Those are not farm workers. Those are farm owners. It's a very different occupation than farm workers. Today, as you can see up there, there's about 2 million farm workers in the United States. Now you may say, where the heck does that number come from? It is completely a generated number, because there is no census of agriculture as far as the number of people who are working in agriculture, especially those people who are working in the fields. And so this estimate of 2 million actually comes from an agricultural economist, Alice Larson, who basically across multiple states, including Oklahoma, she said, well, how much productivity do those states have in terms of their agriculture, and how many man hours does it take to create that productivity? And that's how how she essentially backed into this estimate of 2 million. Most likely it's much more than 2 million, but that's the official figure that everybody uses. So there's 2 million farm workers that are out there in the country someplace. The vast majority of them are young. The vast majority of them are Latino. The vast majority of them are Latinos born in Mexico. So the punchline of this slide is farm workers, although there is variation, farm workers are largely immigrants from Mexico. Now, there's also some stereotypes that are out there, as well as some convenience, shall we say. So sometimes people will say, well, those are all the migrant workers, right? And the answer to that question is no. There are many farm workers, and you'll see some of this in the slides coming up, that are referred to as seasonal workers. That is, they're here in the United States, and they do farm work during the agricultural season. But then they may go on and do construction, or they may go on and do day labor or whatever it is outside of the agricultural season. So those are referred to as seasonal workers. And quite frankly, they make up the majority of that 2 million farm workers that's out there. The migrant workers, which everybody thinks of as far as going up and down the supposed migrant streams, those are actually the minority of workers. Somewhere around 20 to 25% usually is what falls in that migrant classification. Okay? So that's who farm workers are. The Nino Sanos project, though, is fundamentally interested in the children of farm workers. And you might ask, well, how does a work-family guy start looking at children of farm workers? And to me, farm work is the best example of how work and family come together, right? Because you have an individual who leaves their country or leaves their local state where they're currently working for their job. That is, they may be going up and down the migrant stream for their job to do work. Sometimes family goes with them, sometimes family does not. So my background, most of my work is in work and family, and to me this is sort of the, if you were going to put work and family on a shelf and say, what do you mean by that? Farm worker families provide the best example of it because their work and family are inseparable from one another. The way family lives is fundamentally a function of how the work is being done. But nevertheless, this project is focused on farm worker families, and as you see, there's about 880,000 estimated, and as you can also see, that's a vastly outdated statistic, which again gives you some idea of how under-researched this population is. So it's been since 1999 that Rick Mines over in California, Southern California if I remember right, as opposed to Northern California where Fresno is, but nevertheless, since these estimates were made. But you can see that children in farm worker families are in a pretty tough spot, right? 62 to 73% are in poverty, 3/4 of them lack health insurance, over half of them have some kind of an untreated health condition, at least 20% are academically delayed. You may say why? There's a wide variety of reasons for that, including they're out helping mom and dad in the fields. They're not going to school. Okay? And more relevant to this particular topic, somewhere between 23 and 73% of farm worker children are obese. Now you might say, man, that is a wide range. But again, it gives us some insight into how under-researched this group is. That estimate comes from 3 different studies, right? The most recent one is the 73%, and that's from North Carolina. The most conservative one was done in Kaiser et al. In 2002. That was done in California. And right in the middle with Jill Kalinowski was somewhere around 50%. But each of those is based on small samples. Jill Kalinowski, for example, she only had maybe 25 farm worker kids in her study. Okay? So again, it's an under-researched population, but if they're right, even if 50 or 73% are obese, golly, what do you do with that, right? Because it's not like you can say, well, they just need to get down to the gym, right? Because some of them are migrating up and down the East Coast or migrating up and down California. Or if 60 to 70% are living in poverty, how can we actually deliver the services that are necessary to help address those kinds of things? And this project was fundamentally designed with the idea of, you know what? With this kind of a marginalized, some people would say vulnerable population, you can't take a program off the shelf and say, how's it going to work with migrant farm workers? Because it flies against the face of all logic to anticipate that this thing that was developed for inner city youth is going to work with farm workers. Or this thing that was developed for kids in San Diego where there's a large Latino population, or in Arizona where there's a large Latino population, places where there's been a Latino population longer than there's been an Anglo population, to think that it's going to work there as well as it's going to work with farm workers is fundamentally a guess. And so the Nino Sanos project was fundamentally designed to say, what can we learn about the things that contribute to obesity? And because most of the people in the room here are social scientists, we have to have the obligatory conceptual framework. And so consequently, here's the obligatory conceptual framework. It's based largely on ecological theory. That's what we sold it in our NICHD application. But it's not based on human ecology. It's based on social ecology, which I know that makes Jennifer very happy. The fundamental points that we're borrowing from social ecology is the concept that's referred to as a leverage point. And leverage point is something that my mentor Dan Stokel's coined back in 1996, if I remember right. And what a leverage point is fundamentally anything that exerts a disproportionate amount of influence on an outcome. And disproportionate can be identified or defined in a variety of different ways. And Dan suggests that you can define it in at least 3 ways. The first one is it has an impact on a large number of individuals. So that's one way of finding a leverage point. Or it could have such a strong effect, so think effect size kinds of things, that by overlooking it, you're making a fundamental mistake, even if it's only affecting a small number of people. Or, thirdly, if it's something that not only affects this one health thing, but it affects all sorts of other health things. And so the best example of a leverage point as far as human health is concerned, of course, is smoking, right? Clearly, smoking is the #1 cause of preventable death. But not only is it related to conditions of the lung, it's related to conditions of the heart. It's related to all sorts of a variety of things. So not only is it a leverage point for health promotion from the point of view of saying, let's get rid of lung cancer by addressing smoking, but it also helps us take care of a host of other health conditions because of its associated conditions. So these are the leverage points that our project was designed to get at. And if we move backwards, so from how does that work again? That's right. From right to left, we're starting off with we're fundamentally interested in learning about childhood obesity among farm worker children. And of course, the most proximal antecedents of obesity are the things that contribute to energy balance. That is, physical activity and diet. Now, you can say all you want about genetics. You can say all you want about thermal effects of food. You can say all you want about those things. But you know what? Those things have not changed that much in the last 20 years to contribute to the ballooning of obesity. And so while those are clearly important in the energy balance equation, they are not the drivers of the energy balance equation. The primary drivers of the energy balance equation is energy in and energy out. Okay? So that's why we're focusing primarily on physical activity and diet. Now, moving backwards, because we're talking about young children, we're fundamentally interested in what we refer to as the family obesogenic sort of environment. And here we conceptualize that in terms of 2 activities. The one is family food habits, and the other one is family physical activity habits. Essentially recognizing that you don't necessarily teach people about physical activity, especially your children. Rather, it's something that they acquire through everyday life, whether it's through modeling or what are the other mechanisms the child development people can tell me more about. But that's the fundamental idea. But then going back, then we have to recognize that people are situated in larger environments. And that's what we're talking about as far as the community circumstances, and then also the family circumstances as far as what's that family context. And this is going to mean a little bit more as I advance through the slides. But I just wanted to put this conceptual framework out in front of you to kind of say we're looking at individual behavior in the context of family interactions, in a context of certain family environments that are also in the context of a social environment that is Eastern North Carolina. So as far as an overview of the overall project, I just simply want you to know, and I'm breaking it apart this way because I have 2 different kinds of data that I'm going to be presenting to you today. The Nino Sanos project is a 5-year project. We're currently in our 3rd year. It's funded by the Eunice Kennedy Shriver National Institute for Child Health and Human Development. And it's a mixed method study. The first part of it, because childhood obesity among farm workers is as under-researched as it was, is we did a qualitative component to kind of go in and kind of say, what do people even think or say, and by people I mean the farm worker community, think and say about what contributes to obesity? What does a healthy diet mean? What does healthy physical activity mean? Why are those things important to obesity if they even think they are related to obesity? So that's the first component, and I'll be presenting some data on that. Then the second one is a quantitative component, where it's a cohort study of 250 mother-child dyads that were taking quarterly assessments for 2 years. And I'll get into that study design when we start talking about the data. So first, as far as the qualitative component, here you see some of the aspects of the study design. So remember, this is qualitative. We're going in, we're conducting in-depth, semi-structured interviews with individuals using an interviewer, using an interview guide, not a structured survey questionnaire. So this conversation can go wherever the conversation goes. The inclusion criteria for this particular component was that the individual had to self-identify as being Latina. And I will tell you right now, there is one American who married a farm worker who was one of the mothers who participated. And it was really interesting to see how similar, quite frankly, her responses were relative to the Latinas who were Mexican-born. But nevertheless, self-identify as Latina. They or a member of their household had to work in farm work anytime in the past year. And then they had to have a child somewhere between the ages of 2 and 5. All the interviews were conducted in Spanish, and all of the interviews, the interview guide covered 7 main topics, but it was essentially to decompose different meanings of food and eating and physical activity and play and things like that. So those are the codes that are being extracted for this particular analysis. Here you get an idea of what the sample is. It comes from largely 11 different rural counties in eastern North Carolina. We use community partners to help find people. So East Coast Migrant Head Start was instrumental in helping us find folks. We had been doing farm work. They still are. I'm not. Had been doing research in the farmer community for upwards of 20 years. So we had very strong community connections. And so we would get referrals for people who might fit the qualifications that we had. You see how we broke down here as far as migrant and seasonal. We wanted to make sure we had good representation of boys and girls. And when I use the term representation here, we're not talking population representation, but rather the voices of mothers of daughters and mothers of sons, and the voices of mothers of young children, 2 to 3-year-olds, and older children. One of the things that I just realized just now is I skipped over one really important feature in giving the overview. So let me go back now, because this will speak to it. The whole idea was sold on, if you want to have kids ready for school, clearly they need to be cognitively ready. Right? There's no ifs, ands, or buts about that. But their physical capacity to be able to go to school is also important. And so we essentially sold childhood obesity as being an issue that interferes with a child's ability to do well in school once they arrive in kindergarten. So therefore, we were interested in sort of that whole time period from essentially 2 to kindergarten, and you're going to see a little bit more of that kindergarten come up when we get to the quantitative portion. But that's why we stratified it as far as 2 to 3 and 4 to 5 to kind of say, is there some ways where people are essentially gearing their children up to get ready for kindergarten in the way that they're eating, in the way that they're doing physical activity, and that sort of thing. So that was the rationale for that. Now, I personally am not an expert in qualitative analysis. I've been doing it now for the last 5 or 6 years, and I've published a few papers, but my anthropology counterparts over at Wake Forest are the real masters. But the basic overview for the analysis for those people who haven't done this sort of thing is you get data. All right. In this case, it's digital recordings of people speaking Spanish, and you don't want me to translate it because all I know is ¿Dónde está el baño? Where is the bathroom? And una cerveza, por favor. 1 more beer, please. That's all I know. So, point number 1 is you take those digital recordings and you you transcribe them into Spanish. Step number 2, you take those Spanish transcriptions and you translate it into English. Now, some of you might be going, well, that's pretty easy. Google has got one of those things, right? You just go into Google and it's going to spit out all sorts of really good stuff. It's just simple, right? No. All right? So those of you who know translation know that that's not a good idea. But you'll be surprised at the number of people who think, what do you mean you can't just do that? And the best example that we have from our time back in North Carolina is we were trying to find the word for dishwasher. And the word for dishwasher that we ended up taking out into the field ended up being interpreted in the common vernacular as hot water heater. And so we had set like 90% of the sample reported having a dishwasher in farm worker households. And we're like, what? But it's because we found out that we didn't do the translation very well. So those transcripts are then translated, and then those are reviewed by 3 individuals, and they're coded, and that's what the extract codes, triple coding, that's what the triple coding is referred to. So 3 people independently read through the transcripts, assign codes to the various sections that they have some substantive meaning that go along with it. Then we use Atlas TI to extract those segments, and then we did group analysis where everybody read through them and kind of said, what do we think is happening here? So that's the best I can tell you. Hopefully you don't have too many more questions, or you don't have any questions, because I don't know if I'll be able to answer them. So now moving on to some of the results. The first result that came out of this analysis is essentially healthy food is something that energizes kids. It's something that makes them able to play, and oh, by the way, it's the Mexican food. Doesn't matter what kind of content in the Mexican food, right? Doesn't matter if it's beef, doesn't matter if it's chicken, doesn't matter if it's, whatever. But as long as it's Mexican food, that's healthy food. And you've got an example of a quote up there. By contrast, unhealthy food is really just sort of this filler stuff. Frequently that you do get at Migrant Head Start, by the way, that they would argue. And that's largely more of the unhealthy American food. And to me, one of the things that's interesting, and frankly it didn't occur to me until I was putting this slide together, is American food to them was essentially the stuff that's wrapped in cellophane, right? It's not making fried potatoes, say, like some people in here may have had fried potatoes growing up. They wouldn't see that as American food, but rather it's pizza, it's tacos, it's chicken nuggets, it's ramen noodles, it's all the stuff that's in cellophane in some way, shape, or form seems to be what they're referring to when they say American food. Okay? So that's the first thing, is essentially healthy food is Mexican food. It's the food that I grew up with. So my first point that I'm going to make to you is these folks so far are not unlike you and I. The good stuff is what Mom made. I turned out pretty healthy. The good stuff is what Mom made. By contrast, the stuff that you get from the store, not so good. Next, food beliefs. Children's American preferences create a challenge. Now, I wasn't sure to call this a constraint or to call it a belief, because frankly, it's one of those that straddles the line, right? Because essentially what these women were telling us is, some of them, about a third of our sample were sending their kids to Migrant Head Starts. And Migrant Head Starts has certain requirements, that each one of them has to hire a nutritionist to see to it that certain requirements are met. But they can fulfill those requirements in a wide variety of ways, right? So they have to have a certain number of proteins, whether that protein comes in the fashion of, homemade meatballs that somebody makes, or in chicken nuggets that you get off the shelf. It don't matter. But they do have a limited budget, and so they need to make that budget go as far as they can. And so children were introduced to those foods, and then they come home, and Mom's making Mexican food, and they're like, I don't want that. I want chicken nuggets. Or I want tacos, or I want spaghetti, or I want whatever. And so that created this tension that, again, that's why I say I'm not sure if it's a constraint or if it's a belief, because it's standing in the way of what they see as being healthy food, that is Mexican food. But my kid has become accustomed to macaroni and cheese and tacos and whatever it is. So how is it that I can kind of cross this gap as far as being able to serve something that's healthy, if you will? In addition to that, there's also some level of skepticism, and that's this quote down here at the bottom, about whether or not going against convention is actually healthier. So here you see the idea that a mom received, it's a good idea to switch from whole milk to 1% milk. She's like, I'm not so sure about that. That seems to go against my wisdom from times gone by, from my sort of belief that, no, what we have back home is good. So what I'm going to do is I'm going to cut it in half. I'm going to go and buy a gallon of whole milk one week, and I'll go get a gallon of 1% the next week, and hopefully it'll all wash out in the end. So there seems to be a level of skepticism that says, well, I trust the doctors, I still am not sure that this American diet, including recommendations from physicians, may be the best thing. So then we get up to some of the barriers that came out. These are much more sort of structural kinds of things, and I think they start falling out of the domain of sort of cultural belief. And anybody who knows anything at all about rural America, this is going to sound familiar, all right? Because when you're talking about farm workers, about 1/3 of our sample was living in farm worker camps, which I understand is foreign to people here in Oklahoma. But in North Carolina, people can retrieve through the temporary worker program, which is referred to as the H-2A program. They can make requests of foreign-born workers. Part of the requirement of that Department of Labor program is that they need to be provided with housing, they need to be provided with a place to, with food, and they need to be provided with transportation from Mexico and back to Mexico. Now, whether or not all those requirements are actually met, that's an entirely different story. But the point is it creates these sort of enclaves, if you will, of farm worker camps. Because a guy says, you know what, I'm going to need 60 workers to bring in this crop. And so they'll bring in 60 workers and they'll pull in a bunch of trailers or renovate some buildings that may have been on the farm or not renovated on the farm or whatever it is. So that's what we mean by a camp. But when you think about that in rural America, it helps you think about, okay, so when we're talking about finances as being a barrier, you know, we're talking about farm workers, 60 to 70% living in poverty, and we go, not only does it affect my ability to buy food, but it affects the kinds of food that I buy. All right, so that's the variety of things. Children need to eat first. So even though the farm workers are going out into the fields and doing the work, they do their best to see to it that their kids are eating first. And yes, for those of you who are fast forwarding to food security, there's some of that information that's coming up next. But the point is that children are going to be eating first, because especially children in those camps are designed for the workers, not for the children. The children are not allowed in the kitchens. All right? So the women go in, create the food in the kitchen for the workers, while their kids are sitting back in the barracks eating out of a small cooler like you may have had in your dorm, and if they're lucky, a microwave that's plugged in. Okay? So that provides some context there. And then the portability of food programs is a real problem. For those people, again, who are going up and down a migrant stream, just because you get food stamps in North Carolina doesn't mean they're going to work in South Carolina, Georgia, or Florida, or further on up in the East Coast stream. So those are some of the financial barriers that we had encountered. As far as food access barriers, this is where I got ahead of myself as far as the whole rurality piece. This is what I meant to segue with that. I mean, the distance to stores, you know, so you got a quote there, it takes me an hour, you know, just to get there. Or likewise, the amount of time that's necessary. You know, Tony can speak to this more because he spent a lot more time out there collecting data in rural North Carolina. But it's not uncommon for the day to start at 6 a.m. and they don't get back until 9 p.m. And so if you're talking about how are you going to get someplace to shop or buy something in rural America where there isn't a comprehensive grocery store available to you, it's a serious challenge. So it creates a time constraint. And then I've already brought up the point about food storage and food preparation, especially in migrant farm worker housing. Right? So those are some of the barriers that came out of there. So now I want to switch over to physical activity, because again, I'm trying to balance this line of the primary drivers of obesity have to be fundamentally energy balance. That is, energy in and energy out. Energy in, of course, is food consumption. Energy out, of course, is physical activity. And so here's what came out of as far as the beliefs that these farm worker women had about children's physical activity. And the first one is, there's no ifs, ands, or buts about it. Physical play is healthy. And I'll point out here, it was really hard to talk about physical activity without getting into play, because of course play is physical activity. And being able to characterize it as sedentary as opposed to moderate, we showed video clips of children doing different kinds of things to try to see to it that they were zoned in on, so this is what you mean about vigorous play or active physical play. But there is no doubt that play is seen as something that is good for children, but interestingly, particularly so because it gets them ready for the future. They're going to have to be able to work hard downstream, so therefore they must engage in heavy physical play, right? And not only that, but if they're inactive, clearly that's a problem, right? In the case of this quote that's here, clearly that child may have OCD or autism or something. If all they want to do is sit there and play with their puzzles or use building blocks or color or read books, clearly there's something wrong with that child if they don't want to be involved in physical play. Okay? So the take home here is play is good. But too much is harmful. All right? And here we start getting into some of the basic precepts of humoral medicine. So this notion that it can contribute to medical problems, several people would talk about jumping around as problematic because it's going to hurt their insides. This one in particular mentions spleen, and spleen is one of the primary, I'm trying to remember my humoral medicine, but one of the primary origins, if you will, of the 4 basic substances that underlie human existence, at least from that point of view. And the point there with the tenets of humoral medicine, of course, is all about hot and cold. And if you get too much hot, that's going to create a problem. And the spleen, by the way, is supposed to be cold. It's not supposed to be hot. All right? Also, and this is a legitimate concern, there's serious concerns about overheating. In North Carolina, Oklahoma is much drier, but in North Carolina, substantial heat during the summers, substantial humidity during the summers. And so the notion of, if I let them go outside too often, they could get dehydrated and pass out, and that could be really bad for them. But then on top of that, almost inverse to sort of what I would call white middle class America is, but you know, good things come out of sedentary play too. We're trying to get kids to be active, right? Because we're so focused on cognitive skills and reasoning and socio-emotional development and all that other kind of stuff that sometimes we lose track of physical play. These folks are just the opposite. They're like, oh, they're plenty active. I really want them to sit down and focus more so they can be better ready to go to school when they're there. They've got concerns that their kids aren't going to be ready for school, to spell their name, to know their alphabet, to whatever it is. So they would really rather have their kids spending more time on sedentary activities than physical activity because they are active play because they think they're already active enough, which we'll have some insight on in just a little bit. Again, there's some barriers that came out of this. So again, these aren't cultural as much as probably logistics specific. So I'm not going to spend an awful lot of time about it. But on the heels of Jared's tour of the labs, you know, I never gave a blink of an eye to the physical environment until I started doing farm worker stuff. And I can tell you, in all the farm worker studies that we've done, we find pesticide metabolites in every child's urine at levels higher than what you see in the NHANES. So that suggests that at least kids that are out there in the rural areas, if you're interested in cognitive development, knowing that pesticides are a neurotoxin, you're missing part of the important boat. All right? And so that's why I think Jared's presentation and tour of the physical labs that are available here are essential to us to help move at least the human sciences group in a direction that says we want to understand children's development, but by not taking one thing or another for granted, but we want to put children in context. And if we want to understand criminal behavior in adolescents, if we want to understand cognitive development in children, we got to know what's in their houses. We just got to know that. So that's why I put up the point about the pesticide exposure, because that's a legitimate concern. If you're in a migrant camp and you see the crop dusters going by, do you really want to send your kids out there to play soccer? Probably not. Okay, so that's something that we don't usually think of when we think about sort of the rural environment. And then access to community resources, the rural landscape, all that other kind of stuff will be familiar. The social environment is another thing that can be kind of overlooked. And it acts in sort of different ways. And here's where us in the human sciences anyway, sometimes we do our job a little bit too good. And that is, you know, for people at least without documents, they have bought hook, line, and sinker that if their children are outside playing alone, in a fenced yard or not, doesn't matter, they've bought the hook, line, and sinker, the notion that their children will be snatched away from them. DSS is going to come in and they're going to take that child and see to it that that child is put someplace else. Now we all know that that's not true, right? But there's the concern that was voiced allegedly by a pediatrician that that in fact is the case. Okay? So that's what I mean by some of the aspects of the social environment. I mean, clearly we need the enthusiasm from, or the encouragement from mom and dad. Yes, physical activity is good. Clearly that kind of a social environment is important. But when you put it in the context of undocumented, frequently undocumented individuals, concerns about children, concerns about interactions with law and potential deportation, concerns about you may not know who just came into the trailer right next to you as far as what their intentions are. There's an entirely new, I'm not going to say it's a new set of things to consider, because we've heard about this in inner city environments all along. You know, the perceived safety of a neighborhood as being important for physical activity. But this gives it a different twist in rural America, because everybody has this bucolic notion that in rural America everybody knows each other and they go back generations and children just play with each other and they just come back after dark and there's no concerns about that. This is a very stark, different situation than what bucolic rural America is sometimes conceived as being. So here, this is just intended to be a summary slide. I want to make sure that I stay on time. I've got about 15 minutes left, and we're pretty good. But the basic punchline that I want for you to take away from the qualitative portion, and this speaks to some of those things about some of the barriers that people that farm worker families have, as well as the cultural beliefs, is that it's clear that these families believe that traditional Mexican food is what their children need to be healthy. And by healthy, they're not talking physically fit and whatever. They're talking about their children being happy and their children being capable of physical work. Okay? So that's the first thing. The second one is, and again, I'm not sure if it's a barrier or a cultural belief, I'd like to hear other people say, is sort of this notion of, I don't know what to do. My kids come home and all they want is McNuggets and tacos and whatever, but I know that they need this Mexican food to be healthy. So that creates sort of a, what do I do? You could almost call that an acculturation issue, although it's not acculturation per se, but it's an acculturative stressor that families are being confronted with. Physical activity is no doubt, it's good for kids, but in moderation. And again, that's a fundamental precept of humoral medicine, is that there's a balance to the world. Too much exercise, not good. Too little exercise, not good. It's important that we get everything all balanced out. And then lastly, children probably need to spend more time engaging, there's sort of this belief that they need to spend more time engaging in sedentary behaviors, in large part because children are viewed as being very active, as it is. So that's the qualitative component. As we move on then to the quantitative component, here's where we're halfway through the project, and so I'm just presenting data from the baseline survey. But just to give you an overview, it's a prospective cohort design. The goal was to recruit 250 mother-child dyads. It's not intended to be a dyadic study per se, only because mothers are frankly just the reporters of essentially exposures, if you put it in a classic epidemiology kind of framework. Mothers are reporting the exposures. Children and the devices are giving us information on the outcomes of interest. But nevertheless, 250 dyads with quarterly assessments for 2 years. So imagine trying to plan a budget for trying to follow a portion of your sample who you know is going to be migrant farm workers going up and down the East Coast so that you can do quarterly assessments with folks. It's been quite an adventure. We've learned many, many things along the way, but I'm proud to say that we've had much better success tracking people and getting the data that we wanted than what we ever even imagined and what we powered for. So we're going to be in good situations power-wise, but let me tell you, it takes an awful lot of man and woman power to make sure that that happens. The inclusion criteria are largely the same. However, this time we're focused on 3-year-olds. And here again is that point about school readiness. We're following them for 2 years, right? The idea is, where are they then as they're going into kindergarten? So that's why we're focused on recruiting 3-year-olds, is sort of that 2-year window that's leading up to when children will enter into kindergarten. Data collection, you see the battery there, essentially interview-administered survey questionnaires with the moms. The children wore accelerometers for 7 consecutive days, and then we did 3 24-hour diet recalls with moms about children's eating behavior the previous day using the NDSR system, which uses a total pass method that some of you might be familiar with. All right, so here's what that sample looks like. And I'm not going to go through these numbers, but the basic point that I want to say is this looks like a usual farm worker sample, right? So the mothers are largely under 35. Remember I said that the vast majority of farm workers are under 35. Very little education. Most of them are born in Mexico. So that's sort of the whole point here is to say we got a farm worker sample. There's no ifs, ands, or buts about that. On the other side is the children. And when you see 2 to 3 there, you have to recognize we defined 3 years old as 2 years and 6 months to 3 years and 6 months. And just for purposes of ease of presentation, we're just calling them 2 and 3-year-olds. But you see the distribution there. You see that we've got just over a quarter of the sample is migrant. So those are the folks who are going up and down the East Coast. Please know, though, that these are largely, we do have 5 families or so that are going back and forth from Mexico, but these migrants are largely moving up and down essentially from Florida to Maine, right? But they're staying in the United States for the entire time. And most of the children are born where? In the United States, right? So one of the students that's working on Latino stuff is fundamentally interested in mixed immigration status families. This is one of those, these are all those families. Child is a U.S. citizen. Parents are largely undocumented and could be deported at any moment. Okay. That's just a side note. Sorry. Had to take it. So as far as food security, I just created this table yesterday, so don't ask for more detailed information. But here you see that essentially somewhere, so very low food security, low and very low food security, that is high insecurity, somewhere around 51% of households are low food security or very low food security. So remember, this is not about food. This is fundamentally, I mean, it is about food, but this is fundamentally speaking to the financial wherewithal of these families. They cannot acquire food in 51% of the families. Now this is a complicated slide, and I'm going to do my best to talk you through it. As far as operationalizing the quality of children's diet, we used the revised children's diet quality score. Sybil Kranz, who is a student of Maria Segaris over at UNC, developed this or published it in 2006, and so we got her as a consultant to help us figure out how to do it. But the fundamental idea here, of course, for those of you who don't know nutritional epidemiology, you're just like, well, can't you just ask them how many fruits and vegetables they're having? Nutritional epidemiology is probably the most difficult domain of epidemiology as far as figuring out what people have eaten, okay? And then on top of that, you have the whole question of how do you put a diet together in a way that makes people go, is that good or bad? You know, sometimes people say, well, as long as it's 30% or less fat, it's a good diet. That's one view of things. It's low sodium, that's another version of a good diet. If it's, you know, meets the food pyramid, that's another version of a good diet. So the point is that the children's diet quality score and the adult parallel, the adult diet quality index, essentially takes information at the macronutrient level. By macronutrient, think things like fat, think things like protein, think things like carbohydrate, as well as the micronutrient level, think things like specific vitamins, think things like, you know, I don't even know what else goes into it. But the point is it tries to take all that together and it weights it and puts it into a single score. That's what's presented for you here on this particular slide. The average score up at the top is about 62% on a 100% basis. The total actual score that's possible on this scale, on this interval scale, is 90. So if you think it's essentially 62% of 90 is what's happening. But if you're going to put it in sort of an A, B, C, D, D being anything in the 60% range as far as like a grade, so the average score is D for the children's diet. Please know, though, that that's not dramatically different than the US diet for children, okay? But what is different here is essentially where are the deficiencies coming. And in farm worker children, so here if you look where the blue stripes are, that essentially says how many people are kind of scoring good, what percentage of them are scoring good. And you see where the issue really lies is in fruit and vegetable consumption, also in some whole grains, and in sugar-sweetened beverages. Okay? Now the sugar-sweetened beverages is not unlike children in the general population. However, it probably is exacerbated if you again go back to that notion of do you have an opportunity to store? What's the water quality like in rural America? You go out to the farm worker camps and you're going to see kids sucking on Capri Suns and whatever comes in the little foil bag to keep them hydrated. So that's probably where it's coming from in the case of farm worker kids. And as far as the fruits and vegetables, one of the things that came through in the in-depth interviews, but I didn't present it, is essentially if it comes out of a can, that's American, right? So canned vegetables, canned fruits, canned whatever, that's American and that's no good. Okay. So it gives us a sense of where are there potential problems that could be addressed, and what are some of the cultural things that may be underlying that as far as trying to do some kind of an intervention. So now we get up to the physical activity point. And again, just like nutritional epidemiology is complex, doing data with accelerometers is very complex, right? Because essentially what you're getting is this gadget, which Orfeo talked about if you went to his talk, that's getting all the movements that the child is doing. And essentially what you do is you take those movements and you convert them once, I think, into energy that's required, and then you put them together into over epochs to kind of get a sense of how long are children being active. And there's more to it than that. But the fundamental point that I want to make here is, first of all, it's broken apart into how active are children in terms of kinds of activity. So sedentary is essentially playing with blocks, right? Light activity, and Teresa, help me out here if you can. Light is maybe taking a step, flailing your arms around. That would be light activity. Moderate activity would be about, that requires some kind of locomotion and movement for, I think it's a period of time, maybe 10 seconds or something along that line. So it requires at least some sustained physical activity. And then vigorous is up from that. I don't remember the actual operational definition. But the point that I'd have you take away from this slide is, first of all, in a 24-hour period, you can see how time is spent. Now, not surprisingly, what we called a wear day was 8 hours. They had to wear it 8 hours. Doesn't make sense to do physical activity assessment while they're sleeping, right? So if you go over to the far side, that is wear time, that is an 8-hour day, where it's clear that they had the accelerometer on them, you can see that 48% of their time was in sedentary activities, 50% of their time was in that light. Oh, look at it's Dora! All right, 50% there, 9% in moderate, and 9/10% and 0.2% in vigorous. If you convert that into actual number of minutes, so there you see it by gender, by farm worker status. But the point that I'd have you take away from this is that, and Teresa, again, I'll ask you to help me, but it's some governing body of physical education, International Association of Physical Education, or something along that line's recommendation is that toddlers between the ages of 2 and 5 spend at least 60 minutes in open range free play every day, and no more than 60 minutes in sedentary play or in sedentary activities unless they're sleeping. So those are the recommendations that come from that body. And this tells us that those children are not doing that. Which then leads us to the conclusions, or to the overall summary points that I'll make and some conclusions. I'm going to skip this and go straight to conclusions so that there's time for questions. Is that, to me, and admittedly I am a little bit biased, but I would argue that given the evidence that the diet quality of children in farm worker camps is not all that different from kids in general, that the significant obesity epidemic in Latino farm worker children is not being driven by diet, because it's as bad as every place else, right? But they're clearly underactive. All right? So in my mind, as far as being able to do something about it, we have to say, how can we engage Latino children in farm worker families in more physical activity, recognizing that there's the belief that too much physical activity is harmful, recognizing that, in some ways there's the desire for children to be more sedentary, right? Because all the women we talked to thought their kids were already way too active. And the data are telling us otherwise. And then on top of that, there's all these built environment, physical environment, social environment issues that stand in the way of regular physical activity for these young children. And you have to go, how the heck do you touch that? You know, with a 10-foot pole, or however that saying goes. Nevertheless, so to me, as far as resolving or addressing the issue of the obesity epidemic in farm worker children, I think it needs to focus primarily on physical activity. But it's clear also that there's room for improvement on the diet side, particularly in the domains of fruit and vegetable consumption and whole grain, or whole grains rather. And again, I didn't put it up because there's only so much time. But there again, we've got these cultural kinds of things that if American is something that comes out of a bag, can, from the freezer section, whatever it is, but yet you don't have the financial wherewithal to be able to make it to, or the ability to get to a store to buy fresh produce when you're out in rural America, what is the answer to that? Do you try to convince them that cans are not bad? You know, basically say your culture is wrong, cans are okay? Or do you do something else? But nevertheless, I think these data start to speak in the direction of, if we're going to try to make changes to eliminate the obesity problem among farm worker children, Latino farm worker children, we've got some insights, and there'll be more insights that are coming once all the subsequent waves of data are in, so we can plot things like seasonal effects and all that other kind of thing. But with that, I'll be happy to take questions from folks. Amanda.
How many of the children were in some sort of early childhood center or Head Start?
About a third of them.
Okay, because you would think that those kids should be getting that free play time. Did you find that the kids...
No, if you would have noticed that last slide that was up there, it's actually the kids who are in Head Start. Oh, I'm sorry, I was supposed to repeat the question. The question was, is Head Start or formalized childcare, is it enabling more free play for children? And you would think that that is the case in theory, and when we took these data to East Coast Migrant Head Start, they were shocked. However, when you go digging into the literature, what you'll find that the physical education people have known for a long time, that is, child care centers, it's easier to manage children when they're staying put. You don't have to worry about them hurting themselves. You don't have to worry about them hurting other children. You don't have to worry about them going off behind the school and maybe doing things that you don't want them to be doing. It's easier to manage children in sedentary or light kinds of activities than it is in active play. And so that's the way we're interpreting this, is that yes, there is fewer minutes in more minutes in sedentary and fewer minutes in light activity among children who attend Head Starts as opposed to those who don't. And we think it's because it's easier to manage that behavior that way.
There's another leverage point.
But recognizing, though, that only a third of our sample, because that's also another point, and Tony can speak to this more pointedly, and that is, you know, they don't want their kids to go to preschools or Head Start kinds of things. They want their child at home with them. So the first one, in order to do something broadly, might be to fix, and I shouldn't say fix, to enable Head Starts to do a better job with active play, but that's only going to help about a third of those who are actually willing to put their kids into Head Start. Jared.
As far as normal activities, like you mentioned NHANES, where you can look at toxicant levels in the average population, what I didn't see on there, I saw where the migrant workers were in terms of very, very low minutes per day, like 8 to 9 minutes. And I was curious where, maybe these folks know it, I don't. I know that you said the recommendation was for 30 minutes, but I'm like wondering where my kids would qualify, sort of. So I'm kind of curious where the average American family falls in terms of activity minutes per day.
So the question for the video was essentially how comparable, how different is the level of physical activity in these children relative to children in the comparably aged children in the U.S. population. And I don't know the answer to that question because, again, as I was pulling these slides together yesterday, that was one of the things I'm like, oh, somebody's going to ask for the comparable data, and I don't know the answer to that question. Does anybody know off the top of their head?
I just know in the FISH project, which is 1,000 kids in rural Oklahoma, they're not getting the 30 minutes of vigorous or the moderate.
Okay.
Very low percentage. I don't know.
Yes, ma'am.
Good presentation.
Thank you.
Very informative. I had a question like, did you collect any data on milestone of their growth? Like, do they, as somebody else pointed out there, that what is the picture comparing to the average American child? What was the milestone of growth? Because you have certain, whether they had visits to the doctor, did they have, that kind of stuff, and what was the average, kind of cultural thing that they would, how many times they had visited the doctor? Like
that is an excellent.
Vaccination and stuff like that.
So the question is, essentially, well child care, information that you'll get from well child care. What do we have there? And what I can tell you is, and again, this is a very complex data collection. We do heights and weights at each one of them, so we're able to put them on the growth curves, and we are tracking that. We frankly haven't summarized those data in any way, shape, or form. We have, as part of our community engagement activities, fed that information back to the Head Start centers as well as to the individual families, basically saying, your child is here, and if they're in a certain range, you may want to talk to your doctor. If they're in a more of a normal range, just basically say, your child is here. So we do have that data, but we haven't summarized it in any way, shape, or form yet. So that'll be one of those that's in the forthcoming range. Jennifer.
Yeah, I was curious if you were collecting parent BMI data, and will you correlate that with the children's and with the beliefs that parents have about food?
Obviously, we're not going to be, the question was whether or not we'll be able to get some parallel data between parents and children. And the answer to that question is, in some cases, yes. So basic anthropometrics, yes, we're getting height and weights on moms too, so we'll be able to kind of, say, how does BMI hold in a family? But obviously, we can't talk to children about their, well, I shouldn't say obviously. We're not aware of a good way of getting food preferences from young children yet. We know that we can do it with older kids, but not quite sure about the 3, 4, 5-year-olds. So those kind of data we're not getting.
I found it so interesting that the mother's perceptions were that the children were very active, almost too much to a fault, where they want them to be more sedentary. But that's not what the accelerometer data supported. So I was curious if the mothers gave you any concrete examples of what their children were doing or they thought they were doing to be so active.
Mm-hmm. Anybody here who's a parent, and maybe that's you too, anybody here who's a parent of a 2 or 3-year-old? Raise your hand. How would you characterize your 2 or 3-year-old, and what are they doing when they're doing that?
High energy.
But what are they doing that makes you say they're high energy? And yes, I know Robbie, but... I think this is a fundamental point, because frankly, until we had the accelerometer data, because I look at my 4-year-old and I'm like, boom, 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 she's all over the place. And to me, she's very active. And so my assumption is that they were, like any general kind of question, they're kind of looking at a sort of a typical day. What does my child do? They get up, they run around, they do this. Maybe they sit and watch TV for a little while, and then they go and do this. Because that comes through very clearly in the transcripts, is they do this, and then they come and sit down for a little while. And then they go do this, and then they're doing something else. And so it sounds like typical 2, 3, 4-year-old kind of behavior. And so that either suggests that either A, they were overestimating typical 2, 3, 4-year-old behavior, and in fact, they were maybe trying to tell us some things that they thought we wanted to hear, or our devices aren't working, right? But we make it very clear as far as the devices are concerned. If we come back and we have fewer than 5 8-hour days, those devices get sent back and we're going for another week. And so we've got a solid 5 days of 8 hours per day on about 90% of the children. And so unless there's a malfunction in the accelerometers, I'm thinking that the parents are probably overestimating just how much their kids are moving around. And if you think again, I can't say expect you to think about it again, farm worker housing. I mean, take your first college apartment and put 8 people in there. That's farm worker housing. And so what may look like all over the place may be in a space this big, right? So that may be what's going on, but it's an excellent question. It's really an excellent question. Sir?
With regard to that, you said that the accelerometer data is accumulated into epochs. Mm-hmm. How long are the epochs?
That I'd have to go back and check. Essentially the slide on the percentage of time, that was still at the epoch level.
Yeah, if you use large epochs, and you
I'm sorry.
Minutes, and you then label each minute, for example, as active or inactive, but in order for a minute to be active, they have to be active for 45 seconds. If you have kids who are starting and stopping,
right,
it's not continuous.
Right.
So they're going to look like they're inactive because they don't fit your criteria of an epic.
Right. So the question is essentially, how is the epic defined? Thank you very much. So these were done in 15-second epics. So every 15 seconds there was an assessment. And so that's then what was aggregated up. So it wasn't expected that it would be at the minute level as you had suggested. And I should point out, in some ways, to get myself off the hot seat, is Russ Pate, who does all sorts of physical activity assessment for children. He was a consultant on the project, and we essentially took all of his protocols, including his analysis protocols, as far as coming up with these data. So some of it I'm projecting as though I'm a master of it, but in fact I'm just a mouthpiece. But I do know that we did have 15-second epics. Sir?
I was interested to see that in the diet of the children you see a lot of juices, and so I worked in a dental school a while ago, and Latino children really had the worst oral health, and I think people found out that it has something to do with the parents' dietary beliefs that sugar is actually good, and honey for teething and things like that. So do you know whether, or are you looking at the dental health at all?
Excellent question. So the question was essentially, given the high level of added sugars in the diet, what potential implications does that have for oral health? And the point, surprise to me, and hopefully I'm not misspeaking, but just for those of you who are parents and those of you who are out there, it's important to recognize that at the moment, the current science as far as dental caries is that it's more like an infectious disease than essentially, I mean, clearly you need good oral care, but it's not like, oh, it's something you catch, right, from not good care or the things that you eat. It's really more of an infectious disease that has more of a microbial or whatever kind of thing. So that's just to, so people can kind of put things in context about what the question is. But once we saw the original, the first baseline, we went to the field with one of Sarah Quant is on one of the National Dental and Craniofacial, whatever that institute. There's some centers that are out there that are trying to do some epidemiology, and so we went and got some of their measures, and we just finished collecting those. No, excuse me, I think we got like a half a dozen more to get, but we're going to get some oral health data on these kids to try to put diet quality and oral health together. So we don't have those data yet, but it is part of the overall project that we were able to sensitively go, oh, this is an issue. We need to grab it and try to be responsive to it. So good question, but I don't have an answer. Any other questions?
I have another one. Did you talk about obesity or overweight at all with the mothers? Or
No.
Just food, so you didn't get into that issue at all?
Well, we asked so the question was whether or not we talked with the mothers about obesity. And both in the qualitative interviews and in the quantitative interviews, and when we fed back information about where their child was on their growth chart, we purposefully did not talk about obesity, because obviously obesity is a loaded term and a loaded concept. Now, when we were in the in-depth interviews, we used the classic silhouettes that are out there that people would use, and occasionally the mothers would say, oh, that one definitely is gordo, that one is definitely fat. And occasionally they would use whatever the Spanish equivalent is of obese, but it wasn't in sort of it wasn't sort of everyday conversation that it was coming out all over the time that they were sort of talking about obesity in the way that obesity is understood, at least in Western societies. And we purposely did it that way because we didn't want them getting all cued into, oh, this is all about obesity, this is all about obesity. We wanted to keep the focus on what are children eating and how active are children. And so we purposely stayed away from that kind of language. Does that answer your question? Awesome. Well, we are now 10 minutes over. I am happy to take more questions if people have them, but I also want to be respectful of people's time. Please, because actually, I'm going to do 2 housekeeping things. Hopefully there has been a sheet going around about who's here. If you have not signed that, please do so that we can convey to the people who give us money for food that we're not just taking it home and feeding our children. So please make sure you sign that. And also please fill out the evaluation forms that are at each of your stations. Since this is a relatively new endeavor, the seminar series, we want as much feedback as possible. So please don't be afraid to be brutally honest. I will not take personal offense. And with that, thank you very much for your time and attention. I hope you have a great rest of the week.